In complicated pregnancies, that doesn't happen. Right? Because it surpasses the natural course of development. So the mother needs rest or extra care. A mother who needs more physical, emotional pain can obviously offer less to the child unless she is replenished and rested.
Dealing with pregnancy, supporting your partner when pregnant, understanding each other when the partner is pregnant. These are very important aspects of mental health that we need to talk about more. For many wives, they don't get enough support when they're pregnant. So I want to discuss, understand from you what goes on behind in the psyche of the woman when she's pregnant, how affected they are by the hormonal changes, and how do they project it? And also for the male partner, how to support your partner, and also for the female partner, how she's responding and how it maybe triggers things for the male partner. So all yours now.
Okay. So thank you for having me around, and it's a very nice little subsection that you are picking as of now. It's a very important thing. Now, maternal and child health programs, they are around since many years.
Yes.
You'll see as a part of all nations, all governments, all health policies, maternal health programs, child health programs are there. What we see it more is at a physical level. Surviving, nutrition, care, disease protection, prevention of diseases, and that's how these programs are operating. But ever since the mental health movements have started, now the WHO has also started focusing on the maternal mental health within these programs, the child mental health within these programs. So women's health programs are also having struggles and challenges like dealing with infections since a young age in women because of sanitary reasons or hygiene reasons. So it's very nice that now programs are evolving to sort of address the elephant in the room. It was always there. It's just that we were not wanting to see it. And it's nice that the conversation has started. So if you talk of pregnancy, let's just quickly have understanding into it from the point that we can break it down from where it starts and how it ends. So, our first day of our last menstrual period, where we don't know that we might be conceiving this month, the first day of that period, to conception, and then confirming of conception. So first day to 40 weeks from that day, that becomes the entire pregnancy period. It is a 40 weeks period. And what happens, we can break it down for common layman understanding into a 12, 12 and a 12-week period. So first trimester becomes roughly initial 12 to 13 weeks. Then again, in the middle, we have 14 to week 27, which is the second trimester. And same is still from 27th week to the point of delivery becomes the last trimester. And what happens, we can break it down. So this is just a very simple way of understanding. And see, the first trimester has its own challenges. The second one has its own. The last one has its own. So see, it's an evolution. It's a lot of time also. If you see, human pregnancy from conception to delivery, it's a huge amount of time. And the amount of time which a human being spends on child rearing is also very long. At least initial 2 to 4 years. Yes. And then it's a continuous process. It doesn't end at 4 years when the child begins to go to school. It's a long process even after that. Yes. So when we look at pregnancy, the first trimester, you can say, is just the time when someone is trying and expecting a pregnancy. So the couple is expecting somewhere sooner or later they might conceive. In the initial 1 to 2 weeks, they might not know that they have conceived, but little amount of physiological changes will start happening in the woman's body. And what happens around this time is that as the first trimester begins, in the beginning phase, she might have a little fatigue, a little tiredness, a little uneasiness, changes in heartbeat and pulse that she may be able to sense, sleepiness, nausea might come up. There might be food cravings or food aversions. So these are the physiological things which are happening. And why are these happening? Very simple thing is your body is now sort of accommodating the setting in of the embryo. So it is an embryo. In the first trimester, it is addressed mostly as an embryo, not even as a fetus, because we don't know what will be the eventual fate of the fetus. Right? So that is why we say that all these things come up, hormonal changes are coming, and the mother's body is adjusting to now the presence of the fetus. Mother's body has to accept the fetus, and the fetus has to develop an environment where it can interact with the mother's body and grow. What happens around this time is that as the first trimester, psychologically, what happens? Psychologically, see, it's a mixed emotion kind of a period. So confirmation of the news, excitement, and then the thrill around it, particularly if they are in the first pregnancy, initial pregnancies are more exciting as later pregnancies. And at the same time, there is also a little bit of fear. So uncertainty is high in the early pregnancy period. We also know that that's a time where the rates of miscarriages in most pregnancies are higher.
Yes.
So what happens, a little bit of, we know, the social-cultural conceptions around it, don't tell people until the initial 3 months pass, take care of yourself, and don't make it very vocal and open. In a lot of cultures, it is not very encouraged. In some cultures, people are happy to announce even the early pregnancy period also. So this is for the simple reason that psychological uncertainty is there. We do not know the viability of the pregnancy. So it's a mixed bag kind of a situation. Now, the second trimester is a little different from the first one, because what will happen is eventually all these signs and symptoms will settle down. So it's a happy period, mostly in uncomplicated pregnancies. We are primarily talking about uncomplicated pregnancies here. So if there is no complication, if the nausea settles down, the tiredness, fatigue settles down, we feel more vitalized. Smells, tastes of foods are more florid in the second trimester. And it is a time where, women are actually enjoying their pregnancies for most parts. And the male partners are also beginning to understand how they need to learning how to adapt to the women's requirements and the needs. Mood swings, etc., are also common in the first trimester, which are not as common in the second trimester. It could be because of many hormonal reasons. It could be because of social cultural reasons. Also, the uncertainty comes down in the second trimester. So after 3 months or 4 months, we know that it's going to be around. The child is growing normally. The heartbeat is seen. The rate of growth is corresponding to what we are expecting. So what happens that the physical symptoms of the first trimester will settle down, and there will be the baby which is growing inside the mother's womb. So what is more noticeably visible will be a belly line, which is there, will be the gain in weight. So in second trimesters, around 6 kgs of total weight gain will be there for the mother. Then now more than just the heartbeat, you will see other things around for the baby in the ultrasounds. You can see hands, limbs, fingers, and initial lung responses, sucking responses, movement of their hands and limbs. So they learn to do those things. So also they develop the ability to see, hear. They start urinating inside. They start early lung functions develop around till week 24. So all these things are happening. It's a very dynamic thing, dynamic development which is happening. So if you see from the point of conception to say about mid of the first trimester, the baby will be a lemon size. End of first trimester, about a banana size. And then from that point to week 27, about a cauliflower size. And that baby is a handful baby. A baby that is developed in week 24 can survive outside, but the lung functions are very elementary. Cardiac functions, the formation of body organs are still a little elementary. And also what is very exciting for most women is in the second trimester, they start experiencing the kicks of the baby, the movements of the baby. So week 19, that is the sense that I have a living thing alive, and now it's giving me that feeling that it's constantly in me and I have to take on an active role. It's like when the interaction starts, the non-verbal touch-based interaction, and that's when you start feeling it. Wow, it's actually a miracle. Yes. Developing. So you can, mothers usually feel it like a bubble popping or a pop inside, kind of a touchy feeling inside their belly. And that's how it's usually placed. Fantasies of how my child is going to be, what are going to be my family roles around it, how do I want to restructure my home around it, what do I expect from my spouse, how am I going to planning my pregnancy, and then eventually delivery period, immediate period when the child is still around and small. So all these fantasies are going to start, and a female always looks back to her own mother and her own, siblings, sisters, to how is it done in their family, because they are like the templates of how things are usually done
Yes, yes.
and how children are nurtured within cultures and families. So that sense of connection and safety increases between a mother and expectant mother. Because that is the tie, and this tie brings the role, it makes that motherly role more and more strong in the second trimester. So you can, mothers usually feel it like a bubble popping or a pop inside. So that's how the dynamism increases. In the third trimester, what happens? The baby is growing, so the weight of the baby is going to increase. By the end of third trimester, he is going to be like the child is going to be like about a melon size. This much, 2 to 3 kgs. And which is why a lot of organ development is happening. A lot of development in the baby's ability to hear, understand touch, respond to touch, having regular sleeping, waking cycles, sucking responses, blinking responses, yawning responses, all these small things they are going to learn inside only. And they're practicing it, because the minute the delivery is going to happen, they have to do it all on their own, naturally. So Mother Nature is making all the babies practice it inside. They can hear the mother's voice. When the mother touches, the baby can sense it and understand it. Which is the reason why in a lot of cultures they say, no, see good things, do good things, hear good things, because it is reaching till the child's unconscious brain development. And the emotional brain is going to be fully functional at birth. The thinking mind will not be functional. Which is why we don't speak, we can't decide, we can't solve problems. But we can see, we can touch, we can anticipate intuition. Even babies can do it. It's very common that they go in a certain person's godi and they suddenly stop crying.
Yeah. Yes.
They feel very composed. The smell function is highly developed, so they can smell their mothers. Which is the reason why in a lot of cultures they say, no. So it's a beautiful, non-verbal, intricate, intuitive bond that develops between the mother and the child. And some of the physiological things could be, then again, some false contractions that come up in the last trimester. Backache, because the child, pressurizes both the organs around, below, and on the 360 dimension where the baby is growing are going to be contracted, which means your breathing rate is going to become short. Heartburn might be there because the stomach and the lungs are experiencing pressure. Since they contract at the bottom at the urinary bladder, then the sense that you have to urinate more frequency of urination also comes up. Backache because the size of the baby is eventually growing and difficulty in sitting, positioning, sleeping. All these things are coming up. So these are just like the physical parameters. Psychologically, the fear comes back in this for the simple reason, how is the birth going to be like? What if something happens? I hope everything goes on well. Because now the mother has done her work of housing the baby for 9 months. But now eventually what will happen becomes a little, fearful. So a lot of women will have fear of delivery, labor, pain. They might have their preconceptions around it. And a lot of them might also have heard a lot of stories around it. So that is also something. And then it might not always be planned. Like a sudden C-section delivery just happens. You can't plan it. So all those things will induce fear, anxiety, worries, insecurity. Those things might come up. And in natural course of labor, the mother is equipped physically. She's quite made in a way by God that she can immediately take on childcare. In complicated pregnancies, that doesn't happen. Right? Because it surpasses the natural course of development. So the mother needs rest or extra care. A mother who needs more physical, emotional pain can obviously offer less to the child unless she is replenished and restored. So that counterbalancing is very important. And in complicated pregnancies, it's important to understand that it's a journey. And from mothering, it is a beginning of a role. It will still continue after birth as well. So this is like the psychological adaptations throughout pregnancy and what can we expect and what is supposed to be normal. It's important to understand that.
So physically, you've got the 3 trimesters, and it's pretty clear what happens in the 3 trimesters. Psychologically, so it differs, right? In the first trimester.
Psychologically, it differs, yes.
So in the first trimester, it's more of the fear, anticipation, anxiety. And then the second trimester, I guess more people enjoy the pregnancy. That's where I hear people talking about their clothes. So physically, you've got the 3 trimesters.
Happy period. Yeah, it's a happy period. And then you become a mobile, you know how to handle your body. You start shopping for clothes.
Yeah.
And you are expecting how to carry yourself around. You're okay with weight gain. So those things usually happen if the mother and the child are facing a sort of a synergy and they are happily placed. The mother is adapted to pregnancy. She accepts it as well.
Yes.
In the last trimester, what is more common are nesting behaviors. So in normal pregnancy, nesting behaviors will be there. Psychologically normal, physiologically normal, which means buying little clothes for the baby, preparing a baby bag, preparing the bottles, preparing the home, preparing what will, who will take care of what.
Being anxiety ridden and so fearful at the same time.
As well as, yes. So like the mother is preparing her nest now. She knows that now anytime my babies will be expected. So the nest should be a comfortable place for me and the babies.
Yes. So that's what goes through most pregnant women's mentally and emotionally and physically also.
So it's a happy period. Yeah, it's a happy period. And then you become a mobile, you know how to handle your body. You start shopping for clothes.
How, obviously, support from other people really helps. But how does she make herself strong? And what does she have to tell herself in order to not be so reactive? Because I see pregnant women are very reactive to things around them.
One thing is, it depends on many factors. The emotional reactivity will come up, but then it depends on many factors. If she already has a previous history of psychological disturbance or psychiatric problem, it is good to seek professional help. In terms of counseling, in terms of whatever aids can be offered so that she doesn't deteriorate or become unstable or doesn't see it as a burden, because it's going to be a role change as well. And the role comes up with a lot of responsibility. So she should be able to develop herself in ways that she takes up that responsibility, not retires to it. That is something which becomes a little important. Secondly is that one needs to understand it's a natural process. It is not a disease. So nature and your body already knows what to do. As long as you move with flexibility towards it and keep adapting, you will help yourself evolve with that role, with every trimester. Suppose there is some complication, then also taking over control is not going to help you out. Eventually, letting go and allowing is the process of birth, delivery, and adaptation is central to parenting and motherhood.
That's true. So in short,
holding on control is not central to normal motherhood and parenting. Secondly is that one needs to understand it's a natural process. It is not.
And even after birth.
Even after birth. Because after birth, it's everything might not be scheduled according to the time and the synergy that you wish it would happen. It requires a lot of adaptation. So over control will increase anxiety. It will not reduce it.
So in short, be gracious about the change that is happening in your life and let life take over.
Exactly.
Yeah, and even after birth. Do you think reading books about pregnancy and what to expect, do these supplementary help, center the mother or?
To a limited extent, yes, because see, nowadays we also have in India. In abroad, we usually have birthing programs, child birthing programs where the parent gets involved and learns the kind of food, nutrition, diet, cooking, exercises, self-care, care for the growing mother and the baby, all these kind of things. What are the physiological changes and how to become non-reactive towards those changes and adapt to those changes as well. So these kind of customized birthing programs are there, which takes a woman through all these stages, and they are usually offered in group. So you will have multiple experts and allied health experts helping them to sway through it and learn from it. Books are also available. So as long as easy scientific literature is available and given to the mother, it will not cause any over concern. The problem happens when misinformation floods the mind and over information comes in.
Yeah, and in today's world where information is exploding, there are many chances of wrong information reaching the wrong person. And YouTube seems to be a go-to source for all these hacks. In cases where, let's say, some people are from a more economically downtrodden status, how do they reach this kind of help? Because mothers are mothers, whether poor.
Yes. The only option there would be to reach out to hospital-based help, where the hospital can link them to some resources which are available. So, now see, technological innovation are happening at the hospital level also. So they also have mother tracking technologies which are available, child tracking technologies. So there was an innovation where they had a vaccination tracking technology to know how many children were birthed, how many vaccinations they have taken, and how many of them are missing, and actually reminding the parents to come and take those vaccinations, and they are freely available. So such programs are now being offered, and there's a lot of work also going around that. But regular visits would also ensure that. A regular visit to the doctor would also ensure that.
Yes.